So let's begin with female patients and what women can do to preserve their fertility. We have a graph, Dr. Diaz, and then you can help us break down that graph and what some of these issues are. Talk to us a little bit about these.
Sure. So when our young women are diagnosed with a GYN malignancy or another cancer, one of the things that we try and initiate with them is the discussion on either future fertility or what their future fertility plans are. And there are various options for these women. Among them is embryo cryopreservation, and these are for women who are in a relationship already, and with their partner they can have an embryo, and then this embryo can be frozen, okay? For women who are not yet in relationships, or for women who aren't ready to commit to a embryo with their partner, egg freezing is another very good option. And the nice thing about this alternative is, should they find a partner in the future, or perhaps if a different partner in the future, now they have their own frozen eggs. Versus the embryo, there's a potential difficulty should you and that current partner split, who has now the rights over the embryo for implantation in the future. So
is egg freezing the most common?
Probably embryo is the most common.
Okay.
Egg freezing is one that is more preferred. The challenge is it's a little bit lower success rate than embryo freezing.
Okay.
Okay. And then gonadal shielding, for those women who are going to receive some kind of radiation treatment, there's a way that we can try and avoid having radiation spread to the ovaries. Okay.
And it's important to repeat, Dr. Diaz, that depending on what cancer you have,
correct,
and depending on the treatment,
correct,
that will determine the outcome of what fertility treatment, correct?
Correct. And that's why this is, again, is so important to have this to be done in a multidisciplinary group setting with the oncologist, with our fertility experts, and that way we can come up with a plan that incorporates not only making sure the patient has the correct treatment for their specific cancer, but also that we give them the correct options for their fertility preservation going forward.
And one of the ones I had seen on there is the surgical removal of the cervix. And this one's, that's a tough one.
Right, and Dr. Diaz is an expert on this procedure, and he's kind of, he can touch on that more going forward, but for early cervical cancers, there's a way to not take out all of the reproductive organs in a female's body, but perhaps just take part of them in an effort to preserve as much fertility as possible.